Dr. Eichold, E-I-C-H-O-L-D, M.D., Health Officer, Mobile County. This is an interesting patient who presented to the Mobile County Health Department with some very vague symptoms, no history of travel to endemic area where there's Ebola, but had very challenging communication issues because of the concern of not really knowing exactly what she had. It was referred for specialty care to the University Medical Center, who accepted the patient for evaluation. Because of transportation issues, ambulance was arranged, and all the fire and rescue people responded in a very appropriate manner using their biohazard equipment. We think this is a very low probability for a serious infectious disease, but we'll leave it to the specialists at USA Medical Center to determine exactly what's going on with this patient.
Well, her family has been traveling to areas where Ebola is present, isn't that correct?
No, the family members had not traveled in the past 45 days to any of the areas where Ebola is present. She had some family members who had traveled to Africa, but not in the endemic countries.
Can you confirm that a floor has been evacuated where that patient is being treated? I
do not know what's going on at USA Medical Center. I know that they were prepared to evaluate the patient, and that they have been, their infectious disease team was notified on how to properly evaluate the patient, and they're probably taking cautions, and exactly what they're doing is up to the University Medical Center.
Do you know what symptoms she said she had? Did she specifically say?
Well, HIPAA protects her for any of her health privacy, and so she had just some vague, non-specific symptoms.
Can you tell us what time she came in today?
She came in early this afternoon, so it was after the noontime hour, and was evaluated with her non-specific symptoms, and everybody wanted to be very cautious and have concerns about what might be the underlying issue, so we referred her for specialty care.
How long does it take to determine whether someone does in fact have Ebola?
Well, the incubation period is 18 to 21 days, so and she's not been out of the country, and none of her immediate family have been in the endemic area for over 45 years. Haven't been in the endemic area at all, and have not traveled in over 45 days. So the incubation period would be, a period of time if you were exposed, and we don't know when she might have had an opportunity to be exposed to the Ebola virus, but I think everybody is being very cautious and wants to make sure she gets the best care possible. We talked to the doctor in the emergency room, and they accepted the patient to come. So what is their operating procedure? I can't tell you. It's what is your, what is...
Well, there's some folks waiting outside to be seen. That's why I asked when we got to the scene and they were turned away. That's all.
I have,
okay.
Do you know if they had to make special precautions for this woman? And
I have not been inside. We made the evaluation, and they respond in the way that they're supposed to respond, and we apologize for any inconvenience if it's caused to the patients who are waiting to be seen at the facility.
And right now, you don't know where she is right now.
No, I left the health department to come here to talk to the media.
And again, none of your employees will need to be checked out.
I don't anticipate anything different, but we don't really know exactly what this lady has. So
if her tests come back positive for Ebola, then
I would say that there would be other tests that will be implemented, but again, this is a what I would consider a low threshold, but one that we want to be very cautious, and if we're going to err, we want to err on the side of taking care of the patient and making sure they get the best specialty care they can.
We just received from the University of South Alabama Medical Center just a few minutes ago, and we read this too. In fact, let's go to Jennifer Eckman.
And infectious disease specialists have evaluated the patient. After a thorough examination was conducted, it was determined that the patient did not meet the Center for Disease Control screening criteria, and there is no risk for Ebola. This is all the information we will have tonight, given the privacy concerns for the patient. We will have an update for the media at 10 a.m. tomorrow morning. Thank you.
Do you feel the hospital was prepared to take in this patient?
Yes, we were prepared. We were able to conduct a thorough examination of the patient, and we've ruled out Ebola definitively.